Good afternoon. I am Dr. Sanjoy Mukherjee. Today I am going to say something about preterm labor. When a labor pain starts before 37 weeks of gestation, we call it preterm labor. Preterm labor may be or may not be associated with preterm birth. We just try to prevent preterm birth, and the incidence of preterm labor is about 10% of pregnancies, and India is the country which is constitute highest number of preterm birth. There are many reasons for preterm birth. Some reasons are preventable and some are non-preventable. Like history of preterm birth is associated with further chance of preterm birth in future pregnancies. There may be some uterine or cervical operation which are also associated with preterm birth. Some uterine or urinary infections are associated with preterm birth. Why we are concerned about preterm birth? Basically, preterm birth causes huge morbidity and mortality of newborn. If the birth occurs before 34 weeks, it can cause severe damage to the newborn. Sometimes it is fatal also. There may be some problem with respiration, some problem with vision, some problem with future development and psychosocial development. So it causes huge burden to the family and to the society, and in some countries huge burden to the country also. So we are very much concerned about preterm birth. We can try to prevent preterm birth. Sometimes it is possible, sometimes it is not possible. If the history of preterm birth was there and their history of previous cervical or uterine surgery was there, we can try to see whether the cervical length is decreasing or not. For this, we can use transvaginal sonography to assess cervical length, and we can manage accordingly. If a patient have pain in the uterus and uterine contraction with reddish vaginal discharge, she should consult her physician or clinician immediately or to attend the hospital where she has to deliver. If it occurs before 32 weeks or 34 weeks, at that time she should go to a higher center where the facility of NICU is present. Otherwise, she should consult her physician immediately, so we can help the woman and the family and the society to have a safe delivery and to prevent neonatal morbidity and mortality. Thank you very much.